Szasz this spring turned 90 years old and is still going strong, is still writing. His ideas in his extensive published works have not meaningfully or significantly changed since the 70 years he was an adolescent. In other words, for the better part of a century, his ideas have essentially stayed static, and what he believed about mental illness and psychiatry as a teenager is exactly what he is still writing about today. He's basically dismissed 50 years of development in neuroscience since the publication of The Myth of Mental Illness, and he's basically not internalized or not learned from or not bought into the changes, the profound changes in our understanding of and treatment of medical conditions and psychiatric conditions over the past 50 years. I want to examine some of these in a little bit more detail to start to give some actual sort of modern day examples of why Szasz's thinking breaks down and what we really should be thinking today. I want to talk about delirium. And delirium in a medical point of view, from a medical point of view, is a significant disruption to higher sort of cortical brain physiology on account of a general medical condition, drug or medication effect, or withdrawal, or toxin exposure. Basically, delirium is a sort of a confused state, a state where someone's level of consciousness is fluctuating, where they may have disorientation, they may have perceptual abnormalities such as visual or auditory hallucinations. This is the condition where people are picking bugs out of the air or picking bugs off their hospital clothes. It can lead to misinterpretation of events around them and paranoia. This is a condition where you can have what's called illusions, where you're laying in your hospital bed and look at the clock, and instead of seeing the clock, you see it kind of morph into, for example, a devil's head or a devil's face. You can become very scared and start to believe that there's something going on, that your life is in danger, and you can start acting upon that. Delirium is actually quite dangerous. Certainly elderly people who are delirious in hospital, if you sort of plot what happens to them afterwards and well beyond when they recover and well beyond when they go home, their mortality rate is considerably higher than those who haven't had delirium. The treatment of delirium is to find and correct the underlying medical or physiological cause that is driving those symptoms, whether that be a drug that has been introduced, a drug that has been withdrawn, whether that has been complications from a surgery, whether someone had been on a cardiopulmonary bypass machine and is now delirious afterwards, whether someone is withdrawing from alcohol in hospital. You find the reason, the underlying medical reason, and you correct it, but you also manage the symptoms using psychiatric medicine, and you keep that person comfortable and safe, and that may also include actually restraining someone for their own safety. If someone's in the intensive care unit, which is a frequent area where people become delirious, they can be highly disturbed, they can be pulling out lines, they can be pulling out wires, they can be putting themselves in a great deal of danger, and sometimes, unfortunately, restraint does need to happen. So the thing with Szasz is that he would say there's still no specific tissue lesion, there's no demonstrable or measurable part of delirium that you can point a finger at. There's no specific type of disturbance that can be measured. And so maybe delirium is a myth. Maybe delirium is just like mental illness because you can't quantify it. You can't measure it. It's not there, in a way that you can scan it and take an X-ray of it. And that would probably be news to all of the surgeons and all of the medical specialists who work very hard with these patients and who see delirium on a day-to-day basis. Conversely, Szasz might actually argue that in delirium, well, these hallucinations and this paranoia does have a medical cause. Maybe he is going to buy into the fact that there is a physiological disturbance underlying these symptoms, and maybe he's going to buy that. But then he's in a situation where he'll go to someone with schizophrenia and he'll say, well, your hallucinations and your paranoia are identical to the delirious person's, but yours are a myth. They're not based on any problem in your brain. They're not based on any physiological disturbance. That's you having a problem in living. But this person over here in the ICU with the exact same symptoms, well, that's based on a medical condition. That's based on a disruption of the physiology of your neurons in your brain right now. And I can imagine Szasz in court being cross-examined. Well, which of these hallucinations, doctor, is caused by physiological disturbance? What about that hallucination? What about this paranoia? What about paranoia in that person? So this one is a myth. This one is a problem with living, doctor. But what you're saying is that this one is a physiological disturbance based on delirium. It falls apart and it makes sense. And either these types of symptoms arise from genuine, real physiological disruption of brain functioning, or they're a problem of living. But you can't have identical symptoms and identical behavioral disturbances at times, with the origin of one being a myth and the origin of another being a medical condition. It makes no sense. And to my knowledge, Szasz has really not talked a lot about delirium, and I can understand why. Another example that's kind of similar is if Thomas Zaz and I were in this office together right now, and somehow we decided to smoke a whole lot of crystal meth, and then for good riddance we decided to follow that by using a bunch of ketamine to come down. There's a good chance that along the way, one or both of us would become agitated, or impulsive, or paranoid, or starting to hallucinate. There's a good chance. The reason why is because of the specific effects of the molecules of the crystal methamphetamine and the molecules of the ketamine at specific receptors in our brains. So we would have these psychiatric symptoms because of the specific physiological effects of those particular drugs, those particular molecules, these particular receptors in particular areas of the brain. We wouldn't become paranoid and hallucinate if we were sitting here drinking herbal tea. It's not about doing a behavior that leads to this. It's due to specific molecules having a specific effect.